At this meeting, you're going to see a lot of BCMA-directed strategies, and in addition to all of the cellular therapy products, you're going to see a lot of different abstracts with BiTEs. The Pfizer BiTE, which I'm going to refer to as PF3135, was a dose escalation phase 1 first in human trial, and we used it in relapsed refractory, very heavily pretreated patient populations. The one really important feature in this BiTE antibody treatment strategy was the fact that we also allowed for prior exposure to BCMA-directed treatment. So there are patients in this clinical trial who've had either CAR T cells or have had BCMA conjugates, have had belantamab mafodotin as well, and no other BCMA-directed strategy has actually done this. What PF3135 is a bispecific T-cell engager directed against BCMA. It's an IgG2 monoclonal antibody, one arm recognizing BCMA, the other arm activating CD3 cells. And by doing so, once it attaches to the tumor cell, it activates the T cells and causes direct toxicity of the myeloma cells. We started off with a standard phase 1 dose escalation trial, and now we're at a phase where we've transitioned to subcutaneous dosing of this bispecific T-cell engager. And when you look at the overall response rate in all patients that we've treated, it was about 35%. But when we get to the high doses and the subcutaneous dosing, we are seeing response rates in excess of 75%. We are seeing MRD negative disease. We're seeing stringent complete responses in this patient population. Not unexpectedly, you see the toxicity with this bispecific T-cell engager includes hematologic toxicity, which is anemia, thrombocytopenia, and low white cell count. But more importantly, we have seen cytokine release syndrome. We've also seen neurotoxicity, but these have been extremely well managed and really quite easy to treat. We have a low threshold of using tocilizumab in this patient population. Given that this is an ongoing trial, we do not have necessarily a duration of response, but at this year's ASH meeting, you'll see that we have patients who have continuing ongoing responses and very little in way of toxicity. So again, a new strategy, which in my mind is extremely well tolerated in a patient population with relapsed refractory myeloma.